Dr. Osterholm, what have we learned and what do we still need to learn from the COVID-19 pandemic?
Well, first of all, thank you very much for having me on the program here. I appreciate the opportunity to share what we're learning and what we have learned. And when I say what we are learning, that oftentimes is even more in terms of content than what we know. To date, it's clear that this virus is going to keep ravaging around the world until we either have people who are infected and hopefully developing some protection to it, and we'll comment on that in a moment, or having a vaccine that they develop some protection and hopefully lasting for more than a limited period of time. This is a very difficult infectious disease virus to deal with because of the fact that everything appears at this point that immunity or long-term protection may be waning, meaning that in fact you could get infected, you can develop at least short-term immunity, which may last months, maybe even to a year or two, but that if you look down the road, we're going to be dealing with this virus infection for many, many, many years to come. Our only hope is that each time you become infected or get vaccinated, that should you get the new infection or exposed while you're vaccinated, that the conditions would be such that you would have less severe illness and that you would still be protected if you were getting vaccinated.
Great, thank you. And in the next 12 to 18 months, what are you most concerned about how we are or are not adapting?
Yeah, well, first of all, you have to take the viewpoint from a global perspective, because any infectious disease today, somewhere in the world, can be everywhere in the world tomorrow. So even when countries do a very good job for a period of time suppressing the transmission of the virus, as soon as they let up, if other countries are still having major problems, it'll just continue to spread. And that's what we're really concerned about right now. The United States and Europe, parts of South America, parts of Africa, we're seeing ongoing widespread transmission. Areas of the world that probably have it under better control include parts of Asia, not all, but parts of Asia. And when I say under control, it doesn't mean it's going to stop. What it means is, at least right now, they're limiting transmission with the hope that a vaccine will come in and be helpful. Here in the United States, we are unfortunately in a bit of a disarray in our responses. We have a segment of the population that doesn't believe this is real, that in fact it's a hoax. Therefore, you know that they're not adhering to the kinds of recommendations we're making for slowing down the transmission. Others are just experiencing pandemic fatigue. You know, the idea that in fact, I've limited my contact, or I've not been in public spaces and close contact with others, but now it's been 6 to 8 months. Come on. And unfortunately, right now, here we are in the fall of 2001, and we're beginning to see a substantial increase in the number of cases that are occurring in the United States, just as we predicted might happen right after Labor Day. We're seeing that in Europe. Right now, Europe, some of the countries are beginning to look, unfortunately, far too much like the United States. And surely we're seeing that throughout the Americas and parts of Africa, big increases in cases. So one of the challenges we have is helping people understand that we've got a long ways to go. We estimate in the United States that only 10 to 12% of the population has been infected to date, with which those who have recovered would obviously have some immunity for some time. There is a lot of susceptible people out there yet to get infected, and that's what we're really concerned about.
Mm-hmm. Yeah, and thinking about the next bad virus, as I know you often do, what are the top 3 things that should be done to identify, prevent, mitigate it? Who should be doing it? And what are the biggest barriers to doing those things?
Yeah, when this pandemic first hit, I think the world had a sense that, well, we were much more prepared to deal with a virus like this than we really were. And in fact, if you looked at many countries around the world, they basically touted the fact that they had done all this pandemic preparedness planning and that we were ready to go. Well, as you can see, some parts of the world have done a better job, notably some of the areas of Asia. But for much of the world, we weren't prepared at all. The United States being probably one of the top of the list countries we have to consider. And I think the challenges we have are such that Today, we don't have a public that is largely all pushing in the same direction to try to end the pandemic or to slow it down. We've got a very large proportion of our population that believes that this is still a hoax. Up to a third of the US public believes that. When you have the others who are just, fatigued, saying, well, I'm kind of done with trying to distance and not be close, then you begin to realize the challenge we're up against right now in terms of getting people to really take this seriously. So as we look at this pandemic, I think it serves as a model, unfortunately, for what other ones, including the next influenza pandemic, might look like, which surely there will be a worldwide epidemic of a new influenza virus. So I hope that if nothing else over the course of the next few months, as this begins to take a much harder hit into countries like the United States, Europe, Canada, and other parts of the world, people realize, we're not in charge here in many ways. Mother Nature is. And that the best we can do is try to impact what Mother Nature is doing and then try to protect ourselves the best ways we can. But right now we spend far too much time in the rhetoric, in the blame, in the he said, she said, or, well, that's not true, the hoax. And that really distracts us from doing what other countries like China, many of Southeast Asian countries have done in really reducing this transmission because they took it seriously. They gave it the due process that it needed in terms of understanding how to better control it. And we haven't. We've spent more time arguing about should we wear a mask or not.
Good point. So in under-resourced countries and rural communities, what would you emphasize as the most important public health tools and strategies for the next 18 months in light of COVID-19?
Yeah. This is a huge challenge because without a vaccine that's effective, there's not that much you can do, particularly in low and middle income countries. They don't have the luxury of spacing out or distancing. They don't have the luxury of having access to incredible health care. And so this has been a huge challenge for us. And, we've already seen, particularly in South America and parts of Asia, and now Africa, low income countries are really getting hit hard with this, very hard with this issue. We talk a lot about what's going on in the United States and Europe, to some degree what's going on in Asia, but we often don't hear about the tragedies of what's happening in many parts of this, third tier countries, the third world, the second world countries. And so I think this is going to be an ongoing situation where the impact will be for at least several years because it'll take that long just to get enough vaccine manufactured and distributed even to those countries. So my concern is that, as much as we're focused on the US and parts of Europe and Asia, we're focusing on a very limited part of the world's population relative to who's really at risk. And I think this is going to extract a much higher price out of the human population than we have any idea right now.
Mm-hmm. Mm-hmm. So to date, confirmed cases and deaths from COVID-19 across the continent of Africa have been lower than expected. What are your preliminary thoughts about this, and what, if any, lessons might there be from that experience?
Well, two things. First of all, there have been parts of Africa that have been hit hard. Look at South Africa. Look at in the northern part of the continent too. And so I think we have to be very careful about characterizing Africa as just one monolithic big place. The second thing is I think it's time. And what I mean by that is early on in the pandemic here in the United States, there was a lot made about the fact that California was hardly impacted in those earliest months. And, there were all kinds of hypotheses that went around, well, it's because of the fact that they, don't have mass transit, they don't come together. The freeways actually are one thing that's saving them because they have such limited contact. There were all kinds of explanations until June happened. And then when June happened, that all went out the window because California got hit hard, really hard. And I think that part of this challenge we have with responding to this virus is it's like unfolding of the seasons. Some people get hit in the spring, some in the summer, some in the fall, some the next winter. I predict that over the course of the next 4 to 6 months, you're going to see dramatic upticks in cases in Africa, and that a number of the countries that have to date actually had limited activity, that's going to change. And I wish that weren't going to be the case, but I really believe that will be the case. And in the end, this virus is pretty much going to take on the whole world. And until we have effective vaccines, the whole world's going to be vulnerable. And I don't see any exceptions to any place in Africa that would be any different than that.
All right. So, Dr. Osterholm, what advice would you offer Global Health Ministries as a faith-based NGO to better support our partners in low-resource countries?
At this point, we have to just take a step back and understand we're in this for the long haul. It's like so many challenges you already deal with. It's not somehow going to be over with in another week or two. Whether it be antibiotic resistance, lack of resources, you're already dealing with a lot of these on a long-term basis, and you have to factor them in. I think that what's important here is you have to factor this one in. The COVID-19 is going to last for a while, and it's not going to be one that, after a few months like we did with SARS or MERS or the other coronaviruses, where we kind of got it under control and then we went back to normal. There will be a new normal with this virus in our communities. And particularly in the second and third world countries right now, I think, low middle income countries are going to be really challenged going forward because they won't have the resources. Vaccine will be late to get to a low income country in any meaningful way. And we just have to be prepared now for that. That's going to be a real challenge.
Mm-hmm. Dr. Osterholm, we are very blessed and so grateful that you've been able to join us today. Just one more thought. What else might you add to our audience, who consists of primarily global health professionals, missionaries, supporters? Any other thoughts that you'd like to share?
Yes. Well, first of all, thank you for what you do. On a global basis, you are at the very tip of what I would call the leading edge of humanitarian activity. And, from that standpoint, we appreciate very much what you do. I think the challenge we have today is you don't want to step in front of the line over others to get vaccine when it does become available. At the same time, you really are critical, kind of like air traffic control is to a pilot. It's kind of important to have. And so I hope that you'll avail yourselves to vaccines when they become available so that you can be that kind of Rock of Gibraltar fixture in communities wherever you're doing your work. As we know, when you're present, when you're doing your work, when you're able to help organize communities, and unfortunately often have to deal with some very sad days, having you there is critical and important. So I hope that you avail yourselves as early as you can to vaccine. I hope that helps you be able to keep continuity of the work that you do, and on behalf of so many of us from around the world that never fully appreciate the kind of work that you do, the humanitarian efforts you make. I just thank you, and I also say, we need you. So stay well, and know that this situation is not going to get over with overnight. Thank you.
Dr. Osterholm, it's a pleasure. Thank you so much for your time.
Thank you.